In celebration of National Community Health Center Week, the Alameda Health Consortium and the Community Health Center Network extend our appreciation to all clinic staff. While some individuals are receiving special recognition today, we want to congratulate all of you for your dedication and commitment to community-based health centers and the health of our communities. This reception is in your honor.
It is my great privilege to honor our call center this year. Our dedicated team of call center operators makes providing excellent customer service their number one priority. They manage their calls with professionalism, poise, and ensure each patient can hear a smile over the phone. Last year, our team of superstars handled more than 95,000 calls. As the CHCN Patient Satisfaction Survey indicated, 88% of our patients were satisfied with their overall experience when calling into our health center. We are so proud of our team of operators. And a great thank you to Michelle Alejandre, our call center supervisor, Kelly Reed, our operations manager, Gladys Garcia, Ruth Aleman, José Salehi, and Reina Escobar.
It is my absolute pleasure to announce that Lucian Freeman has been named Access Community Health's Employee of the Year. As our Chief Financial Officer, Lucian oversees everything related to our money, what comes in, and most importantly in his world, what goes out. He also oversees our IT department. Lucian is the consummate professional who has reshaped Access's fiscal department. He is a visionary who has the ability to get projects off the ground and into the stars. He is the master of efficiency and cost savings, but he also has the unique ability of being fun to work with, even while he's turning down a request to spend some money. Lucian has fully earned the trust and respect of our board of directors. He is our steady force on the senior team, and he keeps us all grounded in reality, especially when we talk about things that cost money. But he's also a key player when we do dream, as we build new programs and new ways to do things. Thanks, Lucian, for everything you bring to Access, your drive, your dedication, and your unfailing good humor, which gets us through a lot and helps us realize our dreams. On behalf of everyone at Access Community Health, I am thrilled to present the award for Board Member of the Year to John Beauchamp. John joined the Access Board of Directors in 2014. He brings the voice of Access's patients to the board, and he is unwavering in his support for Access. John is deeply committed to mental health issues, and he takes the message everywhere he goes, from his job, where he works tirelessly to support his clients, to his advocacy efforts in the community, and most importantly, to the table at the Access board meetings. John is one of Access's staunchest supporters, and he has willingly and eloquently spoken on our behalf in many settings. He was at his very best when he spoke at our all-staff meeting about his experiences as an Access user, and he described his appreciation for the services he has received at Access, and he talked about his ongoing commitment to making healthcare available for everyone in our community. His speech to our staff was both motivating and moving, and he left our staff more committed than ever. John, on behalf of all of us at Access, thank you so very much for the passion, the energy, and the dedication you bring to us. Your presence at the Access board table makes us a better place.
The West Oakland Health Center is pleased to recognize the pharmacy department for its outstanding service as part of our healthcare team. Under the leadership of Dr. James McCabe, the pharmacy department is made up of a team of trained and professional staff who serve our patients with the utmost efficiency, safety, and sensitivity. The department has an amazing team of stars, which include Dr. Nancy Carpenter, Neiman Kapili, Melody Devera, and our newest team member, Dia Ambriz. Dr. McCabe provides leadership with timely information relative to new drugs, policies, and standards of care that relate to medication use and safety. His team keeps current with state regulations regarding the practice of pharmacy and implements changes as necessary to maintain compliance. A few of the accomplishments of the pharmacy department include the implementation and immunization practice, providing all ACIP recommended vaccines to our patients ages 19 years and older. The department joined a pharmacy services administrative organization and contracted with commercial third-party plans, allowing West Oakland to bill for many prescriptions that were being given away. They implemented a comprehensive travel health clinic, providing vaccines and prophylactic medications for international travelers. The department introduced protocols for the management of insulin changes, providing naltrexone and initiation of inhaled steroids and asthma management. They also initiated programs to support medication therapy management using the Outcomes and Miraxa software platforms. And they recently started an over-the-counter medicine program serving patients as well as staff. The implementation of these new programs has been seamlessly supported by the entire pharmacy team as well as the executive team at West Oakland Health. Once again, West Oakland Health is pleased to recognize Dr. James McCabe and the pharmacy team for its outstanding service.
Our board awardee at Lifeline, and he's an outstanding board member. James right now is serving as chair of our board of directors, but he started with us a number of years ago as one of our youngest board members and has just grown tremendously in the position. He works in the public health arena, but he's picked up both nonprofit board leadership skills and health policy around community health centers and strategic direction questions, and become just one of our most solid and thoughtful board members. He also brings an appreciation of technology in healthcare. I've just become so impressed with James' solid, steady, thoughtful approach to leading the board and leading the organization. Greatest appreciations go out to James. There's nothing like a fantastic board chair, and James Johnson Jr. is that for Lifeline. Lifeline's Excellence in Clinical Services Award goes to Kirsten Flagg, who's a nurse practitioner at our downtown Oakland clinic and in our supportive housing program. She's also picked up and leads our Pharmacy and Therapeutics Committee. She picked up HIV care for us, medication-assisted treatment, and probably is one of our biggest champions for working with the reentry population. Outside of her clinic, she's also been the medical provider who's been doing medical services for folks who are involved with East Bay Community Recovery Program. She's helped to essentially up her own skills in the substance abuse area, the hepatitis C area, and become one of our real stars at Lifeline in terms of this kind of care, difficult patients. So let's just appreciate Kirsten for the enthusiasm and the joy that she brings to the work with patients that some folks would find hard. She does it with grace and aplomb, and she's become a leader at Lifeline, and we really appreciate her. Our outstanding employee at Lifeline is split between Lisette and Lena, who are both medical assistants at our West Berkeley family practice sites. We want to call them out this year for their amazing work with our open access program. Lisette and Lena have been involved in essentially setting up an MA clinic that allows patients to have a number of things done under protocol by our medical assistants before they ever reach the doctor. The two of them have also just been pretty amazing in terms of developing templates for their work that could then be used with others, as well as guides that could be shared with the whole health center network. We've just been very, very impressed with their work and really pleased with that. Lisette and Lena are just amazing team players. They're the kind of folks that are always engaged, trying to figure out better ways to do things and making the folks around them feel better and have a whole lot better day at work. Thank you, Lisette. Thank you, Lena.
Working in community health can be as difficult as it is rewarding. When we find ourselves immersed in the day-to-day, we look to our bright spots for inspiration and to remind us of why we do this work. Our bright spots keep us motivated and moving forward and remind us that we're on the right track. The Native American Health Center's Integrated Behavioral Health Team is one of our bright spots. They light up our clinic because of the work they do and because of who they are. They are a pillar of our system of care. Rosa Solorzano, Mila Stubblefield, Bridget Joyce, and Brenda Bautista make up our Integrated Behavioral Health Team, providing high-quality services and support to our members and to our staff. This can look like assistance with housing, transportation, and access to food resources, individual counseling, and group work for our members. For our medical team, this looks like full-time availability for warm handoffs, facilitating interdisciplinary rounds, lots of laughter, joking, and team spirit. Our IBH team is the definition of possessing a growth mindset. They stay open to a variety of changes, and their agility enables them to function as a literal bridge between our clinicians and most vulnerable members. Our clinicians feel truly supported by the IBH team, as do our members. Our IBH team truly exemplifies integration and our goal to be a learning environment. To the team, thank you all so much for your relentless member advocacy, team unity, and agility. Thank you for being the Native American Health Center's brightest spot.